Okay, so we have here the differentiation between the three species of your schistosomes. So we have here your Japonicum, Schistosoma japonicum, Schistosoma mansoni. We have also the Schistosoma hematobium. Anyway, nasa PowerPoint naman to. So we have here the other name for your Japonicum, that's your oriental blood fluke, Manson's blood fluke, and we have here hematobium is your vesical blood fluke. For the disease, again, your Japonicum here try to cause Katayama fever. We have also the Yangtze fever. For Mansoni, try to cause here schistosomal dysentery. For Hematobium, try to cause vesical and pelvic urinary schistosomiasis. Okay, for adult worms, so for this Japonicum, you could find that one try to inhabiting here the superior mesenteric vein, which try to drains in your small intestine. For Mansoni, that's inferior mesenteric vein, which try to drain here in the large intestine. And your hematobium could be found here in the vesical and pelvic plexus, or even in your urinary bladder. For the integument of their skin, actually their integument of their skin here is their way of absorbing the nutrients. So they're able to absorb the nutrients from the environment primarily by their integuments of their skin. So we describe here the Japonicum as having the smooth skin. For the Mansonis, coarse tuberculation, and for the Hematobium, fine tuberculation. For the number of the testes, so we have here the Japonicum would have here 6 to 8 testes here in a single row, so isang side lang. 6 to 9 in clusters, so there are 1, 2, 3, 4, 7 to 9, and this one is 4 to 5 in clusters for the hematobium. We have here the length of the uterus, so the length of the uterus here for the Japonicum try to occupy almost one half the entire body, so this one 2/3 of the entire length of the body, this one is 1/3 of the entire length of the body. We have also here the location of the ovaries, so for Japonicum, you could find that one at the central portion. For the Mansoni, it's anterior half, and for the Hematobium, that's one is posterior half. Okay, for their egg, Japonicum here try to produce 50 to 100,000 eggs per day. So that would have considered to be the most number of the eggs, but that one is considered here to be the smallest egg size among the three. And we describe the egg of your schistosomes again. As schistosomes here, their egg is not operculated. For the Schistosoma japonicum, that one is lateral knob. So this is a knob-like structure. Here in your Mansoni is spine. Medyo mas pointed siya compared to your knob. So it's lateral spine then as a side. And hematobium here at the end, making that one as described as one as terminal spine na egg. Okay, we have here the prevalence. Japonicum is prevalent here in our country. Even in China and even in Japan. And Mansoni is prevalent in the South America. We have also Middle East, and we have also here the Africa. For hematobiums, it's Middle East and also the Africa. For the intermediate hosts here are actually the snail. For Japonicum, that's your Oncomillania quadrasi. For the Mansoni, we have here the genus of your snail, Biomphallaria, and we have Australorbis. And for the hematobium, that one is your Biomphallaria and Bolinus, the genus of your snail. For the specimen, we can recover the egg of your schistosomes here. For Japonicum and Mansoni, we could have your stool sample as your specimen for that. And could have here for hematobium, we have the urine. So if you find here, for example, the schistosomes like the egg in the urine, so that's for hematobium. You will never recover Japonicum and Mansoni in the urine sample of the patient. Okay, then we have here the pathologic manifestation of your schistosomal infections. The first one, we have here the lesion and the granuloma formation because of the oviposition of the egg here in your venous. Second one, we have here the allergic reaction and the skin dermatitis because of the skin penetration of the cercaria. Third one, we have here the eosinophilia, increased eosinophil count with a fever manifestation in Katayama fever related to your Schistosoma japonicum infection. Another one, pneumonitis with hemoptysis, or speaking of the sputum with the blood because of the migration of your schistosomule to your heart-lung migration. Number 5, we have the pseudo-tubercle formation, which is a non-necrotizing, non-inflammatory cellular infiltration. And we have also here the cystitis. This is a type of renal kidney problem. Cystitis is just urinary tract infection. Calculi formation is your stone formation related to your hematobium. Kasi ang hematobium lang natin ang pumupunta or could infect here your urinary bladder. Okay, to diagnose infection, we have the laboratory tests. First, you could have the DFS with your stool as your specimen. You could also perform urinalysis here for your hematobium. And for Mansoni japonicum, for identification of the ova, you could have here the DFS. You could also recover the ova through your concentration technique. Could also have the rectal or the liver biopsy. And you could also have the skin test for allergic reaction related to this infection. Could also have serological testing like your ELISA, your enzyme link immunosorbent assay, immunoradiometric assay, cephalin cholesterol flocculation test, and we have also your circumoval precipitation test. Okay, then we have here the test, the COPT or the circumoval precipitation test. So this is just a precipitation reaction or an agglutination reaction. So for this test, we are detecting for antibody present in the patient sample. So you're going to collect blood in the patient. So the source serum, you'll be needing serum here. Then what you are identifying will be the presence of the antibody if the patient has been infected by the schistosomes. So, since you're detecting for antibody, ang reagent mo dapat is the antigen, and a positive antigen here in the form of the ova coming from the positive na specimen. Ova of the schistosomes. So, imimix mo lang ito, then try to seal that one. Incubate at 37 degrees Celsius here for 24 to 48 hours. Then you read the result here after 48 hours. And observe here for the bleb formation or precipitation reaction near the ovum. So, kung ito ang ova niya, so observe mo kung nagkakaroon dito ng agglutination reaction or bleb formation near that one. So, pag nag-positive mean to say the patient has been infected and the patient has already antibody against the infection. Another test, we have here the egg hatching technique. So, we have here the Foss and the McLenny's egg hatching technique. So, your specimen could be your serum, could be your feces or urine. And then you just need to you put that one in a beaker and try to boil at 60 degrees Celsius here. So if you're suspecting the patient, sample here contain the ova. So pag ni-boil natin the ova, we're going to hatch, it would try to release the miracidium. And what you're going to identify here under the microscope will be the miracidium. So pag nakakita ka ng miracidium, mean to say the patient is infected. Kaya nagkaroon sa miracidium kasi may ova, mean to say infected ng patient natin. Another one, schistosomal hatching test. This hatching test here, schistosomal hatching test, would be the same principle as the Fawcett-McLenny's egg hatching technique. Only that, magkaibang kanilang setup. So, may Erlenmeyer flask ka na ginagamit. Pero ang principle nito, ang kanyang reaction is still the same, where you need to identify the presence of the miracidium. Then we have the Falcon assay. This is an agglutination test recommended by the Centers for Disease Control and Prevention. But you need to confirm the test with your immunoblood. Okay, the next one, we have here your Schistosoma mecondri found in the Mekongri River in Cambodia. So it would resemble here the morphology of your Schistosoma japonicum, only that is much smaller compared to your japonicum. And the host for that would be the dog. Then we have this Schistosoma intercalatum. It would have here the same morphology as with your hematobium, only that the terminal spine is much pointed and less curved, plus would have here two terminal spines. Okay, the next one, we have here the lung fluke. So we have here the Paragonimus westermani. So other name for this one, we have here Oriental lung fluke. So called here the Stoma westermani, the Stoma ringeri. And we have also here the Distoma pulmonium. So try to consider paragonimiasis, and also try to consider endemic hemoptysis, characterized here by the splitting of the sputum with the blood because of the manifestation of the bleeding in the lungs in the bronchial tree. It could be mistaken as your pulmonary tuberculosis, but you need to differentiate that one by doing your culture and sensitivity. So, since ang ating pulmonary tuberculosis caused by the bacteria, so when you're having the culture and sensitivity, it will give a positive result for that. But if this one is your Paragonimus westermani, it will not give a positive result in the culture and sensitivity of your bacteria because again, this is not a bacterial infection. Okay, for the morphology of your Paragonimus westermani, adult worm is ovoid, it's flat. It's described here as spoon shape when alive or active. It's coffee bean shape when preserved or killed. Yes, the adult worm also characterized here by irregularly arranged testes, and they are arranged here side by side, one on the right and another one on the left. We'll have here the zigzag intestinal ceca. Again, adult worm for your Paragonimus westermani is eventually housed here both the male and the female reproductive organ because this one is hermaphrodite. Unlike the schistosomes, you have separate the male and female adult worm. Here, you have only one adult worm. For the ova of your Paragonimus westermani is laid unsegmented or unembryonated. I mean to say, this is when the adult female worm try to lay this one, this is unembryonated or immature. So we describe this one as yellowish brown. It's just parang siyang chicken egg. We have here a thickened na thick-shelled operculum. And on the opposite end, meron din dito na thickened area. You call that one as your aboperculum. Operculum and aboperculum. Okay, then we have here the intermediate host for your Paragonimus westermani. Again, the first intermediate host would be the snail. We have here the rice field snail. We have the Brotia asperata. And the second intermediate host here would be your, we have the Parathelposa grapsoides, which is your crab. And we have also here your crayfish, which is your Sonda thelposa philippina. Okay, then basically again, what is present in the first intermediate host will be the Cercaria. Will be the present. The second intermediate host here would be your Metacercaria. Okay, for the life cycle, you get infected here by the Metacercaria in the second intermediate host. So that could be found here in your crab or even in your crayfish. If you try to eat those second intermediate hosts containing the encysted Metacercaria, try to eat it one uncooked or properly cooked, then you get infected by that. So the Metacercaria enters your body through your MES, and when go here in your small intestine, try to exist. And then this existed Metacercaria will try to circulate your body and go to penetrate your blood vessels and eventually going to your lungs. In the lungs, they try to mature to become adult worm. And after that one, after several days, the adult worm here try to lay egg. And eggs of that could be found here in the sputum, or some of the egg here could be swallowed back from your lungs going to your gastrointestinal tract. So bababa siya ulit. And this egg here could pass out in your stool. And remember that the egg of your Paragonimus westermani is unsegmented or unembryonated. It needs to go to the water for it to undergo embryonation. Once embryonated, it try to hatch and try to liberate your miracidium. This miracidium will penetrate the first intermediate host, which is your Brotia aspirata. Inside the Brotia aspirata snail, this miracidium here try to develop to other larval stage, become the sporocysts, magiging Regia and Cercaria. The Cercaria will be released out of the body of the snail. The Cercaria will try to find here the suitable second intermediate host. And remember here that ang mga host nila are very specific ito. They could not have here another host na hindi sila pwedeng mamili. Okay, because they have a certain affinity for their host. Okay, then again, the Cercaria will try to go to the second intermediate host, which is your crab or your crayfish, where it try to encyst to become your Metacercaria. Then, if your Metacercaria or the second intermediate host will be eaten as raw or uncooked properly, then you get infected by this Paragonimus westermani. Okay, then we have here the pathology related to your to the infection related to your Paragonimus westermani infection. So we have here the endemic hemoptysis. Again, this is characterized here by the fever, sweating, headache, or back pain with sputum with a bloody, rusty sputum. The second one, we have here the abscess formation or the granuloma formation found in the lymph nodes, in the brain, in the muscles, testes, and the liver. Another one, Jacksonian epilepsy, because this parasite could also migrate. As to try to migrate to other part of your body, could also go to your CNS or central nervous system. It could affect your meninges, try to cause your meningoencephalitis, giving a characteristic epileptic seizures. For laboratory diagnosis, you could have here the DFS for identification typical egg related to your Paragonymous westermani. You could also concentration technique with your acid ether concentration technique method. So your specimen most likely for diagnosis here could be bronchial washing or aspirates because again your parasite is in the lungs. You could also have the sputum examination. For the sputum, you need, before you try to examine that one, you need to digest the mucus here because it's highly mucoid. So it will be difficult for you then to identify the parasite. So you need to digest that one with our mucolytic agents. You could use your 10 to 30% hydrochloric acid or your 3 to 5% NaOH. And the X-ray could also identify the presence of your encapsulated na adult worm. So they are within the capsule in your lungs. The adult worm could be found on the lungs here. They are encapsulated on that. But you could identify that one when the patients undergo here the X-ray examination of their lungs. And they will have here the characteristic bunch of grapes arrangement because of the ring shaded opacity which measure 5 to 10 centimeters containing mga small na mga contagious cavities. So para siyang mga grapes, bunch of grapes appearance because of that.